Welcome back here to MSMR Wellness. We're talking today more about sport specialization and sort of the misconceptions behind some of the stuff and the risk behind it. And we started talking about it on our Facebook page, and we got a good following from it. And I think because it's a pretty big topic, you know, with the push now to have kids in specialty sports that require almost a 360 type timeline.
It's very important to kind of define specialization and kind of split that apart a little bit. I think it's very easy for us to say, well, don't specialize. Well, there's different forms of specialization and what that's. So I think that's one big thing that we really want to hit is, what does that even mean?
Right. And I think what we're really trying to talk about here is that, yeah, skills specialization is completely different. Okay. We understand that in order to get better at any one sport, we're not saying you have to take 9 months off here, but we are saying that giving up on other sports could be to your detriment.
I think the big one for sure is skill specialization versus competitive hyper-specialization, which is that competitive calendar extends throughout the entire year, or even in a weekend, like some of these AAU tournaments that, you know, one of them was highlighted in the ESPN article that we posted on our Facebook. You know, they're playing potentially 4 or 5 games in a day, not just in a weekend, in a day. I mean, of course, you're going to have kids, you know, youth kids that are anywhere from 9 to 17 going to have some injuries at the end of that. So that can definitely be a big issue for any sport. And I would say basketball is an easier one to kind of have more competitions in a day and a weekend. But I think youth soccer is another big one too. In our area, youth lacrosse is a big one where you can kind of rack up a couple of games in one event.
I don't think that's the way. If you think your son or daughter is going to be a pro athlete, I don't think that's known to be the way to go. I mean, you think of pro athletes like Joe Mauer was one of them that comes to mind. A very well-known catcher for the Minnesota Twins. He was an excellent football player. And he did have to make a choice, but he didn't have to make the choice until he was 18 years old. So in the studies was 14 was probably optimal for if you really wanted to just take the next step in a sport.
Yeah, I think there's a couple of studies that we highlighted in our newsletter. Again, one of them was specifically hockey, which is not near and dear to my heart, but near and dear to my homeland of Michigan, right, where you get a lot of youth hockey players as young as 4, 5, 6 playing 12 months a year. Right. And they think, okay, if they're playing, 12 months a year and everything like that, they're going to be a professional player. Not quite the case. So they found with a lot of elite level, which they would say is high D1, professional, collegiate, all those kind of different categories that you would call as an elite player. At 14 is when was their average year of where they would specialize or hyper specialize into one sport. And I would say for sure those sports that have some different movement patterns relative to how the body is known to function normally, like hockey, it can be if you're doing that 12 months a year, you could definitely see some hip issues, some lower body issues develop as early as your 20s or 30s that you would not see until you're 60.